what my mother did. She made jokes for the whole thing when she first found out she had breast cancer. And at the time, the ratio was like 1 in every 10 women.
Wow.
And I'm sure it's more now.
Like 1 in 8. Yeah.
Yeah. When she was telling her girlfriend, she called and she was like, I just want you to know I have breast cancer, but 1 in every 10 women get it. So I just saved 9 of you bitches. You're welcome. Hi, everyone. Welcome to Do-Over Divas. We have a special guest today in honor of Breast Cancer Awareness Month.
Dr. Adrienne Waks is here from the Dana-Farber Cancer Institute. She is a breast cancer oncologist, and she is here to answer all of our questions on breast cancer treatments.
All of us have had friends and family and people we love that have had breast cancer. Thank you. What is the first thing you tell people to do when they hear the words, you have breast cancer?
I mean, first take a breath.
Breathe. That's exactly what I was going to say.
Large majority of women who get diagnosed with breast cancer, have to go through this really scary episode in their lives and then are doing great over the long term. So take a breath. And then, of course, call the doctor who ordered the imaging or the biopsy that led to that diagnosis, like your PCP or your gynecologist, and or call, a cancer center near you so that you can get set up for an appointment and start to figure out what your next steps should be. I think everybody always feels better once they have a plan and have some steps in mind. That's a lot easier than sort of feeling like you're hanging out with no idea what to do next. So connecting with the medical professional and getting your appointment scheduled, I think, is the first.
Small steps is always the best approach, right? Yeah.
So many options: surgery, chemo, radiation, hormone therapy, and I mean, you're at the forefront of the research. How do you navigate all of that?
So, I think first of all, it's definitely mainly your medical team's job to guide you through that. No patient should have to feel like it's on them to be making any of those decisions in a vacuum. The reason you should, connect with a medical oncologist like me, a breast surgeon, a breast radiation doctor, is so that they can offer you that guidance. And, what I always try to do is say, of course, it's ultimately the patient's decision. I'm not here to make any decisions for you. It's up to the patient what they want to do. But I'm here to give you the options that I think are reasonable, try to explain the pros and cons, and ultimately, of course, to make a recommendation, because I don't think it's helpful just to say, like, there are 5 options. Why don't you tell me which one you like? That's hard.
And I'm sure it depends on someone's family history and the individual that you're dealing with.
There's so much,
person.
exactly.
Yeah.
And, some patients will come in feeling like, I just want somebody to tell me what to do.
Yeah.
And some patients will come in and say, I've gotten a whole bunch of different opinions and done a lot of my own research, and this is what I want to do. And, so we obviously have to partner in figuring out, like, well, how much guidance do you want and how much guidance are you going to give me about where you're coming from and what your, decisions and priorities are. Yep. But ultimately, you're right that it is super complicated and there are a lot of choices. And that's what the medical team is there to guide you in. I mean, I would also say that, of course, while that I think is a foundational principle, most patients who are diagnosed with breast cancer will have done, in spite of themselves, a lot of Google searching before I meet with them, and I totally get that, because the first thing that I would also do, even if people told me, like, come on, it's not the WebMD is not going to have all the answers, you're just looking for any information, then your appointment is a week away or 2 weeks away, or maybe it's tomorrow, but you're just like, need to gain some control and do some of your own research. So,
and you want to feel somewhat educated when you're speaking about it, a little bit about it.
Questions and, that makes perfect sense. So I think inevitably, even though guidance from your medical team is so important, almost every patient will come in having looked up a bunch of information ahead of time.
Sure. I have a question. I don't know if it pertains to you, but they thought they saw something on one of my breasts. This was several months ago, and did the ultrasound, nothing, and then they gave an MRI. I couldn't get through the MRI. I tried 3 times. And then I finally went back and they saw nothing on the ultrasound. So they're like, you're fine. So I don't know if this is your area, but I'm thinking, oh my God, should I have gotten that MRI? Would it have seen things the ultrasound didn't? And I know that's very common for women. I've spoken to so many women who had the exact same experience that I walked around thinking I had breast cancer for about a month. But apparently I don't. I'm very lucky. So what do you have to say about something like that? Is that something that you can speak to?
So, I mean, a couple of things. Number one, I think, I'm sure that resonates with so many people and women that it's the waiting and the uncertainty. That's so hard, waiting for the appointment for the MRI, waiting for the biopsy if you need it. It's so.
Oh yeah, and you feel like your
so
brain is just
it's
your brain
awful.
is growing it because you're focusing on it so much.
Yeah.
I'm like,
and I was digging. I even had my husband dig in the boob to try and
Right. What am I missing?
Yeah. What am I not? Yeah.
And you're like, if I know what's going on, I can deal with it. I've got this.
Yes.
But not knowing what's going on is really, really hard. So first of all, I'm sure that resonates with so many people. It certainly resonates with me. And I hear that all the time from my patients. And unfortunately, it's part of our medical system, really the medical system internationally. That is what it is. You just don't get appointments the next day most of the time. But it sucks. So yeah, that is too bad. I think the experience also that you voiced just about MRIs.
Oh, it's horrible.
Is also really common. It's just one of those things where even if you're mentally walking, you're like, I'm fine. I can do this. Like, I'm not worried. I'm going to get it done. It's really sort of a physical reaction to the positioning and the noises. And for some MRI machines, being in an enclosed space. And so there's a lot of women who walk in with every intention of completing the study.
I tried 3 times, and now I'm thinking, oh my God, should I have done that? I am very claustrophobic. I mean, I drugged and everything. I couldn't do it.
Right. So, one thing that you can try as a strategy is trying like an anti-anxiety pill before.
Yeah, I did that. Nothing. So my concern is how necessary is that MRI? Like for what? Because I actually met with a bunch of women recently, and 2 of them had the exact same experience, and they didn't get their MRI either. And so we're thinking, do we need to be concerned?
Yeah, I mean, an individualized answer to that question, and obviously, defer to the breast radiologists who are taking a really careful look at your images and the images of other women in the same situation to really reevaluate, like, okay, if I did a really careful ultrasound here and then, 1 month later I did it again, and if I juxtapose that with my mammograms, special views, like maybe it's ultimately really okay. Yeah. So I think there's different answers to that for different women. In general, a mammogram is a really, really good way of looking at breast tissue. It does an excellent job, the best of any type of breast imaging, of looking for calcifications, which can be a really, really important, early sign of breast cancer or breast cancer precursor. An ultrasound can sometimes add to a mammogram for certain women, or certainly if you're looking to specifically visualize like a certain area of the breast. An ultrasound can sometimes see things that a mammogram can't. And the opposite is true too. A mammogram can see things that an ultrasound can't. Right. And then breast MRI in general can pick up things that a mammogram and an ultrasound both cannot. So it is possible that there are breast abnormalities that an MRI would show that just can't be visualized, or at least can't be, fully characterized on mammogram and ultrasound.
Is there anyone, this is a really ridiculous question, but in speaking to girlfriends about this and about mammograms, honestly, I mean, what percentage of women have dense breast tissue? I mean, there's no woman that I know that has not been told, well, you have really dense breast tissue. So it's like, and they just go, well, fuck, what have I been doing?
Working out.
Yeah, exactly.
So the ultrasound
why
woman
don't I
said,
have dense biceps? I have dense breasts.
Can I have dense abs?
Yeah. So, I mean, what percentage, does everybody have dense breast tissue?
That's a great question, and I do not know the answer to what % of women have dense breast tissue.
Come on,
but what I want
to lock you down on this.
It is a lot. It is a lot. I fully agree with you. It's not, a tiny minority. It's a lot, and it's very clearly age associated. So younger women in their 40s, certainly 20s, 30s, but then even 40s, 50s are much more likely to have dense breast tissue compared to women who are in their 70s or 80s, because that's just sort of a part of the normal.
So we have young
process.
boobs. Yeah. I got young boobs.
You've made Jill's day.
You did.
Exactly. So you guys are very youthful.
And we can call it a day on
Call
this.
it a day.
Happy.
Mic drop.
with dense breast tissue. And, it's part of why, so it's very common, and it's especially common in women in their 40s and 50s. And it's part of why there's been some controversy about whether women in their 40s should even get mammograms. That's been controversial over the previous decades.
Because you can't really see clearly?
Of the way that it's just not as good at visualizing what's there and what's not there in a younger woman. Now, don't get me wrong. At this point, it is clear that the standard recommendation is that women should start mammograms at age 40.
Yeah.
And I fully support that. But, part of the historical controversy between age 40 and age 50 about whether women should get mammograms was because we know that dense breast tissue can make it so hard to interpret mammograms in such a high proportion of that age range. But
and why do mammograms still suck so much?
Oh, God.
Come
in terms
on.
of discomfort, you
Oh,
mean?
God.
Like,
Hold your breath. Don't move.
And stand like this.
Wheezing.
Why does it have to still
It
be like that?
honestly feels like a man designed this just to get even with his mother.
Yes. Spot on.
I do. I totally hear that. And I think it's even worse once you've had a breast cancer or a biopsy or something, then there's been some tissue rearrangement and, inflammation from radiation and things like that. And then, then it can be really uncomfortable.
I started to black out last time I had, not last time, 2 times ago. And it almost discouraged me from going back, but I'm like, no, because it's in my family. So obviously I definitely religiously get my mammogram. And maybe I had a really rough technician. I don't know. Because I have a pretty high tolerance and they're like pain. Well, afterward, yeah. But I felt it getting dark. I'm like almost passed out. And I was like, I need to sit down. And I didn't think it was from the pain. I didn't know what it was. Wow. But yeah, I think it was it got just too intense.
Too much. Yeah.
It also feels like sort of a high pressure situation. It's a little anxiety provoking and there's somebody giving you all these instructions and it's uncomfortable. So I'm sure you were not alone probably even that day in terms of women.
Yeah, probably.
We have a lot more parts than men. And do you ever meet with the patient who's like, wait, I know more because Google says this, but you're saying this? I imagine that's something that you have to encounter frequently, right?
That happens all the time. Yes, all the time. And, I try to guide people like, look, there are really great resources out there. Always try to point towards don't just type it into Google and then take the AI summary that's at the top these days.
That's always wrong.
Because that really can be misleading. It's like some of it's probably super right and some of it's probably super wrong and you can't tell it apart. Yeah. And it may just all be right, but it doesn't apply to you. So, it's not a very helpful way of approaching it. But if you really are feeling like, God, I need to get some information and get my questions in order, in the absence of having had a medical opinion yet, then go to websites like American Cancer Society, go to websites like Susan G. Komen or the Breast Cancer Research Foundation, patient advocate group websites, where there's really sort of national reputation and expert reviewed entries. Try to be getting your information from those types of websites. And some of them, honestly, I think, I'm thinking of things like American Cancer Society can be super helpful. Like, here's a list of questions you might want to make sure that you hit at your first appointment.
Yeah, that's always good.
That's
that
vital.
kind of research. Right.
Yeah.
Because you always leave going, I should have asked this and I didn't, and then also to have maybe an advocate go with you.
Yeah,
someone else
another set of ears.
Yeah, because if you're the one getting the diagnosis, you're flustered. You're not going to think. Yeah. You need someone that can write down the questions for you and make sure that you get them asked.
Yeah. I think that is for sure the case. It's always a good idea, definitely at your first appointment and potentially at every subsequent appointment, maybe until they get super routine, to have at least one other set of ears with you. Mm-hmm. I think especially at the very first appointment or few appointments, you have to sort of anticipate the fact that it's just going to be so emotional. Yeah. Even if you go in, as emotionally prepared as you can possibly be, it's still going to probably hit you in ways that you're not fully prepared for.
And you're going to start hearing it like the teacher in Charlie Brown.
Oh, yeah,
totally.
100%.
Yeah. My God.
Exactly.
It's overwhelming.
Exactly. And so I think I think there's actually data, brain MRI studies showing that once you hit a certain level of anxiety, you really can't take in any more information.
Critical mass.
Intellectual level.
Yep.
Which I think we can all probably just feel from various personal experiences.
Daily.
Definitely. Right. Exactly. So definitely having the second set of ears there to listen for you so that they can say, oh, no, I thought, that this came up and that came up, and to help you, ask your questions. And like you said, sort of advocate too. But I think the most important thing is just making sure that there's somebody who can listen alongside you and be hearing the same thing. So you can debrief after.
And hold your hand, I mean, it's...
Not to mention, of course, definitely emotional support.
Corey's mom had breast cancer. My mother-in-law had a double mastectomy. Thank you. Over 40 years ago. How different is it today?
Well, my mother 30 years ago had a lumpectomy, fortunately. So, they caught it in time, I guess. I mean, I guess that's the reason she was able to do that, not a mastectomy. But, things are very, very different than they were 30 and 40 years ago. And I'm sure there are many other options. So, I have that memory of it. But yeah, tell us some of the more recent innovative things that you're excited about helping, using to help people.
And by the way, both my mother-in-law and your mother
survived
great
it.
Prognosis, survived it. My mother-in-law, Jane, is 91 and a half years old. So still kicking and smart as a cat.
No experience of it recurring,
No.
which is fantastic.
Yeah, that's the other thing. The recurrence, that it's very scary for women.
Yeah, that's where a lot of the fear comes in, most of it, I think. But yeah, I mean, I could have a day-long symposium to answer your question about like how far have we come, because thankfully the answer is that the advancements that have been made since 40 years ago and 30 years ago for sure, but even luckily since last year, are huge in breast cancer, and that's one of the things that actually drew me to being a breast cancer doctor in the first place, is that it's a really common cancer. And it has a lot of, so even if everybody, either they've had breast cancer or they know, or they have a family member who've had breast cancer, or they have a friend who's had breast cancer. And so everybody, I think, feels engaged in sort of moving forward breast cancer research. And, we're so lucky in breast cancer to have such an engaged and motivated patient population. Patient advocates have done a huge amount of work moving breast cancer research forward and sort of reminding us to keep it, a really high priority and a really urgent priority. So that's something I love about, the breast cancer patient population and, family and friend support network of breast cancer patients.
Sure.
So we made a ton of progress driven by that motivation over the last decades. It's completely true. There really is basically no comparison between breast cancer treatment today and 30 to 40 years ago. I mean, virtually all of the medications that we use, the surgical techniques that are used, the radiation techniques that are used, are completely different. So there is, it's always really scary when a family member had breast cancer 20, 30, 40 years ago or whatever, and you have to sort of parallel that experience with your own if you're newly diagnosed. But thankfully, there are really very, very few parallels there.
When you say different, do you mean more effective or less side effects or both?
Or less invasive? I mean...
Yeah, all of the above.
It's all of those things. So I would say, in three sort of different categories. In terms of breast cancer medications, developing medicines that are more effective, we do that, on a monthly basis now, basically, through better breast cancer research. So more effective medicines. A lot of our medicines now are more effective and they have fewer side effects. They hit both of those things because we understand the pathways we need to hit better. And so when you hit a pathway better and in a more specific way, you leave other tissues alone, and so that translates to fewer side effects. So better medicines with fewer side effects for sure. And then in the realms of more the breast surgery and the breast radiation, which we think of as local therapies, those are dealing locally with the breast tissue. I think there we've gotten a lot better at causing less sort of damage, honestly, and side effects. We used to do huge surgeries to remove tiny breast cancers, used to do incredibly comprehensive radiation. And as the years have gone by, it's become clearer and clearer that in almost all patients, doing the maximum in terms of surgery and radiation is probably actually too much. We were doing way too much, 20 and 30 years ago.
Just trying to blast it.
And also Exactly. And the side effects, of major breast surgery and radiation, again, decades ago, were enormous,
Oh,
and
yeah. My
yeah.
mom's skin was just
pain,
burned,
The
fried from the
recovery.
radiation. Yeah.
Yeah.
So we do a lot better with that now. We've really sort of pared back, while still maintaining really, really good efficacy, pared back how much surgery and radiation many women need. And we're learning better and better how to individualize how much surgery and how much radiation a woman needs, so that, even if you looked 10 or 15 years ago, we were doing like evaluating lymph nodes under the arm in virtually all women, doing radiation for a number of weeks, daily treatments for a number of weeks in virtually all women. And now we know that actually there's a lot of women who don't even need even one lymph node taken out under their arm if we select them correctly.
Wow.
And there's a lot of women who can be treated with a 5-day course of radiation, which is a lot less disruptive than, 4 weeks, 6 weeks. So we've
That's
really,
a
without
huge
compromising
difference.
efficacy at all, made a lot of progress there.
Yeah.
What's the most promising treatment out there right now? We hear about immunotherapy, there's so many different treatments. What's the one that's the most promising that people, you've seen the best results?
I'll give 2 answers to that. And, I'm a medical oncologist, so I prescribe breast cancer medications, which I think is what you're talking about. But there are certainly innovations that are exciting and important, like we just said, in radiation and surgery. Those just aren't really my areas. I think in terms of breast cancer medicines, across really all solid cancers, the type of cancer medicine called antibody drug conjugates, or ADCs, that's really probably the most exciting, or one of the most exciting classes of medicines in breast cancer right now, and again, across all solid tumor oncology. What an ADC is it's an antibody drug conjugate. So the antibody means there's an antibody that is targeted towards some protein on the breast cancer cell. There's lots of abnormal proteins on breast cancer cells, so you can pick a whole lot of different targets. And then it gets linked or conjugated, that's the C, to a chemo molecule, which is the drug. So it has an antibody, it has a drug, and it has a conjugation, ADC. And the chemo molecule can have all sorts of different mechanisms. And so these are really sort of modular medications, because you can switch out the target of your antibody, you can switch out the type of drug you attach to it, you can switch out, actually, interestingly, how that linker technology works. And that actually really impacts the properties of the medicine. So number one, it's a really modular type of medication, and so it has a lot of potential, again, across a bunch of different targets and treatment mechanisms. But number two, just in general, in breast cancer, over and over again, when we've compared our good effective chemotherapies, that we've used for 20 years, 10 years, even newer chemotherapies over the last 5 years, when we've compared those to ADCs in head-to-head comparisons. The ADC, it's basically a smart delivery system for chemo. The side effects, unfortunately, at the end of the day, are similar to chemo. But the efficacy, it really seems better in pretty much every head-to-head comparison.
And it
sounds
like it can really be individualized,
yeah,
too.
It seems targeted.
Yeah, very specific.
Yeah, more targeted, exactly. Yeah. And it somehow makes it so that because you're getting, there's all sorts of conjecture about why it's working so much better. But, because you're getting the chemo molecule right where it needs to be, and less of it is spreading to healthy tissues and causing you side effects,
poisoning
you just more optimally, treat that cancer cell. So that's one of the most exciting, in general, technologies, I think, in breast cancer.
And how prevalent is that? Are people using that in a lot of places, or is that just specific places that have
very, very prevalent at this point? Although, what's really up and coming is, it's like, I think right now there's probably 4, if I'm counting quickly in my head, 4 ADCs that are FDA approved in breast cancer, but there's probably 300 that are in clinical trials or something like that. So, the 4 that are FDA approved are widely used. But the frontier of what's going to come over the next 5 years, which is more available at this point in things like clinical trials, that's huge and has a lot of potential.
Yeah.
ADC side effects, they're still kind of similar to chemo side effects, but at least you're getting those side effects with better efficacy.
Right, with better, that's the key right there. I will suffer through anything.
It's more worth it.
Yeah,
exactly.
I'll suffer through anything if I know it's going to make me okay.
So You work at the Dana-Farber Cancer Institute. And I mean, it's amazing and one of the leading breast cancer research centers in the country. When I go to you, I know you're going to suggest whatever is, the newest drug, the newest treatment. What about when I go to other doctors who may not be connected to an institute like yours? Can you give me advice on how to choose my doctor and how big a choice that really is?
I mean, yeah, no, I think that's hard. One question you can always ask a doctor is like, have you seen a lot of cases like mine? Like, do you see a lot of breast cancer day in, day out, week in, week out, or not so much? Because, it has nothing, it just has to do with how much exposure somebody has, how much familiarity do they have with treating a certain type of cancer. So that's one thing you can ask. And I think probably your best resource for answering that question, I mean, number one can be friends and family and other people's experiences at a given cancer clinic for sure. But a really good resource should honestly be asking your doctor, like, is my case making sense to you? And you've seen other cases like it and you feel like you have a good sense of what's the best treatment course for me. Or
I don't know a lot of doctors, arrogant male doctors specifically, that are going to go, it's not making sense to me. I'm working on it.
Yeah.
But
yeah.
Right?
I hear you. Maybe I live in an overly optimistic world, but a good doctor should say to you, like, yeah, I think it's worth talking to somebody else. You're asking really good questions and I don't know all the answers to them. I see a lot of cases like this. This is a really straightforward case. I think that you're in really good hands right here. I hear you. I mean, you can't necessarily.
See, I'd hear that and I'd be like, oh, no, you're full of shit.
But
I mean, I would be so,
and you might be right,
skeptical, because I'd be scared.
Yes.
So, of course I'm going to get a second opinion, third opinion, whatever.
Oh, yeah.
And
But
that was
there's
going to
some
be,
people
should
that-
you always get a second opinion?
Well,
I
I
mean-
would think so.
Yeah.
I mean, here I work at Dana-Farber Cancer Institute. Like I have, I put a huge priority on, mixing clinical work and breast cancer research, and, seeing only one type of cancer. And so, I bring a big bias to this conversation because, of course, I think that there's value in that sort of super specialized expertise. So yeah, I think in general, it's a great idea to get a second opinion, but I also think there's huge value in, being treated close to home. It's already, cancer is already a huge disruption. It's going to take up a ton of your time, whether you like it or not, and trying to manage that aspect of things and still maintain normalcy in your life is actually really important and also is good for your health, So there's a lot to be said for getting treatment, somewhere that's close to home.
That said, I was just going to mention that there's a lot of women that don't have the option of going someplace else, in terms of like what the cost of it. And, they have to be treated close to home, which is wonderful, unless you don't feel like the providers there and the people that you have been referred to are up to snuff.
And hearing you and listening to you.
Yeah.
Right.
Really hearing
so
you.
in that case, I guess you do have to be diligent with, WebMD. No, I'm just kidding.
And so getting to the medications that you have researched so extensively in the treatments, which sound really wonderful and like they're the next step towards helping women get through a breast cancer diagnosis without the incredible suffering that some of them have to endure. That said, if I were to be diagnosed with breast cancer, is there anything in a lifestyle when someone is diagnosed with breast cancer they should be doing?
After the diagnosis
after the diagnosis, while they're going through treatment, that helps that treatment?
Yeah, no, it's a great question. And the answer is unequivocally yes. I mean, it's really honestly the same set of healthy lifestyle behaviors that we know can prevent cancer in the first place that can also help you tolerate treatment better. And actually the number one, a really common side effect of our cancer treatments is fatigue, reduced energy. And obviously that's not an easy thing to medicate. There's not like a pill for cancer.
Speed. You could take speed.
That helps.
What was that?
She said speed. Methamphetamines was her answer. But yeah,
there you go.
It has its downsides, as you can tell. Really the best studied, and there have been pretty good studies in breast cancer anyway, a way to address cancer-related fatigue is physical activity.
Which is exactly what you don't want to do when you're exhausted.
You just have to plow through it, I guess, right?
Yeah.
Which is
so
what women do.
The lifestyle approaches that are helpful for anybody who's undergoing breast cancer treatment. Again, number one, I would say is physical activity. I always tell patients, of course, you're going to have days you just are not going to get off the couch necessarily. That's fine. But, don't have that be every day. Don't have that be most days.
Oh, so sorry you were going to say that. I was afraid you were going to say that.
It's important. We can all know, I know myself, that is a hard thing to find time for, and life is busy. But it's a very important thing to.
Yeah, and if it makes a big difference, then get on it. Right?
And women are definitely the superpower of I'm tired, but I'm going to get up and do it anyway.
Yeah, we have to.
Yeah. We do it every day. So just tap into that if you're going through treatment and go get off. Just do 10 minutes, and then that could turn into 20, and then you're outside, and you forgot you're going through something that's scary, possibly, right?
Yeah.
I mean, that helps too.
And a little bit of sweat on a walk is better than chemo.
Yeah. Yeah.
and that's exactly right.
Maybe to you.
Yeah.
Yep.
It's not that everybody needs to be, then running a 5K and then a half marathon.
Exactly.
It's just
get outside.
Walk around the block and just be outside.
Yeah. It can change everything. And just seeing the sun, if there is sun where you are, or even if there's snow, just get outside. That's, very important.
Regular physical activity is a really common recommendation that we make for people who are going through treatment. And of course, as you said, nutrition, is important, more so to improve just sort of overall well-being and how you're feeling. It's not like, a lot of patients will say, well, I read that I can't eat sugar because it caused my cancer. It will worsen my cancer. I read that I can't eat dairy because it will worsen or cause my breast cancer.
Yeah.
That's really not the case. There's not that direct of a connection between any one food or food group and getting or worsening a breast cancer.
Okay, good.
That's good to know.
But definitely, generally healthy diet is something that will just help you feel better, and that will keep your body healthier, and you'll have more reserve to tolerate things like chemo if you need them.
And the physical activity you're talking about, is that primarily for your physical health, heart health, or is it mostly stress reduction? Since that
I think
contributes
it's
as well.
all sorts of different positive impacts. The studies that I'm referring to were specifically looking at physical activity to reduce fatigue for patients who have a diagnosis of breast cancer. Yeah. But why is that happening? Is it because of stress reduction? Is it because of something different? Yeah. I'm not sure. It's probably all of benefits. The above.
Yeah.
Is there one truth about breast cancer everyone should know?
One truth about breast cancer. I mean,
it sucks.
I don't know if I can boil it down to anything. There you go. To anything that, that's singular. But what I would say is, again, I think it's so important, and something that I always feel for in my patients is that sometimes when patients get diagnosed with breast cancer, sometimes people, they don't know what to say, they pull away, and it ends up being a really isolating experience. And so I think one thing that's important to remember is just, it's so common. And like we said at the beginning, everybody is going to have breast cancer or know somebody with breast cancer who's been affected by breast cancer. And so, just one truth would be just remember that you can help that person, you can support that person just by sticking around and saying like, well, I'm here if you need me, or not, whatever. But, just by being a support, even in tiny, tiny, minuscule ways. Yeah. So I don't think that's really what you're getting at, but I think that's an important.
That's
and I think laughter is really important. Like if I ever get diagnosed with something, I want you all to make me laugh throughout the entire process because it's really important for real.
That's actually what my mother did. She made jokes for the whole thing when she first found out she had breast cancer. And at the time, I'm sure it's different now, but at the time the ratio was like 1 in every 10 women. Wow. And I'm sure it's more now. Yeah. But I remember
1 in 8. Yeah.
1 in 8. And maybe she was wrong about this, but she did, when she was telling her girlfriend, she called and she was like, I just want you to know I have breast cancer, but 1 in every 10 women get it. So I just saved 9 of you bitches. You're welcome.
I love your mom. Your mom. That is the best.
An excellent message. Yes.
Yeah.
That's amazing.
9 of you bitches.
Yeah. You're welcome.
So we'll take one for the team.
You seem like the doctor everyone would want because you're not only so knowledgeable, but you're compassionate and you feel
so grounded.
And grounded.
Really
and it's
lovely to talk to
individual.
you.
Like
Yeah.
I would imagine every patient is so unique to you, not just in how you see them as women, but how you treat them. That's rare.
I would wish you for everyone who ever has breast cancer that they get a you. What
Very kind. Thank you.
What made you become an oncologist that specializes in breast cancer?
And do you remember?
So many things.
And do you remember? Like, because honestly, the path can get complicated.
Things. And I love my job. I mean, like, this is such a wonderful job. It is so interesting every day. You meet so many amazing people, having an easy time, having a hard time, whatever it is. It's an absolutely amazing job every day. But what I love, why I got into it and why I still do love it, they really are pretty overlapping. But I love specifically about taking care of patients with breast cancer is that you get this really nice mix where, you help guide somebody through a really scary episode in their life. Because even if it's, a really small, really low risk breast cancer, which a lot of breast cancers are, it's still disruptive. It's still scary. It's still never a good time to have that happen. And so, you're always guiding somebody through a really scary, unexpected event in their life. And that's a, really special, close relationship. And we have so many things we can do to make that better. So that's really, gratifying. And then there's so many patients who they get through that and you get this really nice long-term relationship where they're just absolutely fine, and I'm just hearing all about the kids, the grandkids, the drama, the lack of drama, whatever it is. I'm getting advice on raising, teenagers. I don't have teenagers yet, but I ask everyone I meet for advice because when I get there, I feel like it's going to be the worst.
Brace yourself.
Worst
That's my advice.
2 words. Brace yourself.
So,
hold on for dear life.
You get this really nice mix of like long-term sort of survivorship period where women are doing really well and still, like you said, living with fear of recurrence, and you have to navigate that, but generally doing really well. And then you also get these times where you're, in really getting somebody through a really, really intense treatment period. And I think it's a nice spectrum.
That's lovely and hopeful.
And very hopeful is everything, right?
Yeah.
Hopeful and laughter. That's how I want to go forward.
Yeah,
well, you've been so amazing. I can't appreciate more your sharing your time and expertise with us.
And for all the women, thank you.
Yeah.
Really.
So informative. I honestly feel like we could probably talk for a couple of hours, but I know you're very busy.
Yeah. She has patience.
You have
and,
actual
solving
people that need
cancer
you.
And stuff.
You're trying to cure breast
thank
cancer.
You. I appreciate you having me.
Thank you so much, Dr. Waks. We will see you next time on Do-Over Divas.
Thanks
Next
for being
time.
here.
Thank you.
New episodes of Do-Over Divas dropping every week, wherever you get your podcasts.